Thank you very much. Well, good evening all. Welcome to tonight's Health Adult Social Care Policy Accountability Meeting. This is the first meeting of 2024, and it's also the first meeting that we're having at 145 King Street. This is the new venue where we're going to be having future meetings. So welcome all. My name is Councillor Natalia Perez. I'm the chair of the PAC. Before we make a start, I have a few housekeeping points, please. This meeting is being live streamed to the Council's YouTube channel. By participating, you are consenting to being recorded. Please, can officers and guests introduce themselves when they first address the committee? If the fire alarm sounds, please leave the meeting in an orderly fashion by the staff fire exit, which is behind me to my right. Officers will direct us to the assembly point in Riverside Gardens. I'm now going to move on to apologies for absence, and this evening we've had quite a few apologies. So we have apologies from Councillor Ann Rosenberg, Councillor Emma Apthorpe, Councillor Amanda Lloyd-Harris, and Lucia Boddington. I understand that some of them are ill, so I wish them a prompt recovery. We also have Victoria joining us remotely. Thank you so much, Victoria, for joining us online. Due to the number of apologies we've had, we aren't quorate because we need at least 3 councillors. However, I would like us to proceed as an informal meeting. Everybody happy with that? Great, thank you very much. Agenda item number 2, declarations of interest. Do members have any declarations of interest? I can see none. Thank you. Agenda item number 3. Do members agree to minutes of the meeting held on the 15th of November 2023 as an accurate record? Agreed? Okay, thank you very much. So agenda item number 4, 2024 medium-term financial strategy. It's our annual budget meeting, and we are kindly joined this evening by Councillor Rowan Ree, Cabinet Member for Finance and Reform, as well colleagues from the Finance Department. We've got Sukhvinder Kasi, a Strategic Director of Finance, Prakash Darianani, apologies for that, Head of Finance, Social Care, who will be introducing the item. And also joining them is Dr. Nicola Lang, Director of Public Health, and Joe Beatty, Director of Social Care. Yes, Jim, go ahead.
I just want to ask on the minutes, are the matters arising?
Thank you very much. Okay, is there a follow-up, please, or an update on letters arising?
It's a follow-up. There are 2 things. One is we discussed at the previous meeting, we discussed the fact there was no money forthcoming for refurbishing Charing Cross or Hammersmith Hospital or rebuilding St Mary's. In fact, since then, there's been an acute board in common for all of North West London, all the trusts. And when it was put to the CEO of Imperial, what was the case about money, he emphatically said no new money of any kind had been offered to Imperial for either refurbishment or rebuild. And I think we should actually write to Matthew Swindle, who's the chair of the board, to regret the fact that money isn't there, because it is quite important that the hospitals, which are falling down in poor physical condition, needs any help it can get. So I would suggest we write a very short note to the chair, regretting the fact there's no money. I've got a second matter as well. We spent quite a lot of the last meeting on vaccination. It was quite a lively event, and I'm wondering, has anything happened since then? I've got 2 orders of question. I'm wondering, do we have up-to-date figures from the local NHS? Again, I'd like to ask, because it's in the minutes, uptake was very poor in our borough and across Northwest London generally, but we're here in our borough. I'm wondering what's been done by the ICB to actually increase intake among hard to reach groups, and that means actively reaching out to groups who traditionally have had a very poor uptake. And I'm wondering, as well as that, is what kind of detail have we got about a local action plan? Because I've seen nothing at all from the local NHS to say that they've actually done anything particular since the last meeting. And that's quite regrettable, given that prevent is one of their key objectives in the ICB. Vaccination is a key preventative measure.
Thank you very much, Jim. All very, very important and relevant questions and follow-ups. So in relation to the first suggestion, I definitely agree that we should write to the chair. I'm wondering if we can agree to the action and if Linda Jackson could assist in that process. Would that be possible as an action? Also, in relation to the other questions, we do have this evening a public health update, and I don't know if I'm going to ask Dr. Lang if you want to address these questions when we cover the agenda item, or would you like to answer the questions now?
I've prepared a slide deck, so I don't know if is that all right? Yeah, thank you, Mr. Greeley.
Thank you very much. Okay, so let's proceed then to agenda item number 4, 2024 medium-term financial strategy. I would now like to invite Councillor Ree, please, to talk us through the budget and the overview on the decision-making underpinning the budget this year. Thank you very much for joining us this evening. I appreciate that yourself and the team, the finance team, have been quite busy in the last couple of weeks, and I think you've been here every evening, so thank you for your time.
Thank you very much, Chair. Well, there's nothing really on television this week, so I don't mind coming here and spending my time with you. Thank you very much for inviting me this evening, Chair, committee members. It's great to be able to come here and talk through the budget. It's been a bit of a labour of love for us for the last few months now, so it's nice to be able to finally unleash it on the public. Yeah, it won't have gone unnoticed that this is a difficult time for local government, but despite the difficult financial constraints that we're under, we've managed to put together a budget that both protects the core services that residents here in Hammersmith and Fulham rely on, but also that goes further, that protects some of those services that are unique to Hammersmith and Fulham, things like free home care, things like the free breakfast for primary school children, things like our local law enforcement teams, our council tax support scheme, our ethical debt collection policy, all of these policies that residents rely on and value so much. We've been able to protect those as well. And the way that we've been able to do that is through the ruthlessly financially efficient approach that we take to budgeting and managing money, but also to continuously reforming the way that we deliver services to residents. And I'll touch on all of those subjects briefly, if I may, before we start. Before I go any further, I'd just like to thank all of the officers who've done such a fantastic job putting this budget together. Sukhvinder and the finance team have very much led me through the process, making sure that all of our figures add up, making sure that we're identifying savings and investment opportunities across the council. The officers across the departments have done an absolutely fantastic job. They're combing through their budgets, going through every line, every detail, every penny spent to make sure that we're spending money as efficiently as possible, and identifying areas for savings that aren't going to affect residents. And my cabinet colleagues as well, who've done a wonderful job managing their department so effectively this year. I'm always incredibly impressed with the way that councillors like Councillor Coleman are able to manage such a wide array of services, but also to make sure that everything comes in within the tight budgets that we are setting. Now, as I say, it's a difficult time for local governments. You know, anyone who's turning on a radio, opening a newspaper will see some terrible headlines about councils across the country, whether it's Woking, whether it's Birmingham, we're seeing places across the country just unable to meet their financial obligations. 1 in 5 councils this year have said that they expect to have to issue a Section 114 notice, effectively a declaration that they're not able to make ends meet. And we've had dire inflation over the last few years, unprecedented rates in recent years, certainly. But yeah, and that means that we're in a difficult position when it comes to setting a budget. Since 2010, the grant that we've had from central government has been cut by 56% in real terms. That's more than half. We started this year at the budget setting process with a budget gap of £25 million. That means before spending a single penny extra on any new services, we had to find £25 million of savings. So incredibly difficult, very tight constraints that we're working in. But despite this, we have been able to put together a balanced budget. We have been able to find over £10 million of new investment this year. And we have been able to protect, as I say, the services that residents rely on so much. Now, this has only been possible because of the ruthlessly financially efficient approach we take to managing budgets, and the fact that we are continuously looking to reform the way that services are provided to make sure that they're both as effective as possible, but also as efficient as possible, delivering the most bang for their buck that they possibly can. Now, we do that through three ways I'll briefly touch on. Firstly, an innovative use of new technology in local government. I think we're very much at the forefront of this, using things like artificial intelligence at the adult social care team, and robotics and automated processing within our revenue and benefits services, just to make sure that things are processed quickly and as efficiently as possible. We are looking at organisational reforms, sort of how the council operates itself. We've got 4 big cross-departmental programmes. I think the time of salami slicing in local government is very much over. All the low-hanging fruit has been picked. So it really is a case now of us having to go through how the organisation operates as a whole, and trying to work out whether there are ways to do things more efficiently. We've got 4 big cross-cutting programmes that we're looking at this year. Firstly, the council's property portfolio. Are there things that you could be doing more effectively to squeeze as much as we can out of that? Commercialisation, is there additional revenue that we can be generating as a council from elsewhere, perhaps selling our services elsewhere, or working out the things that we do very well and trying to make some money out of those elsewhere. Looking at staffing across the council, and then finally looking at our use of data. The council holds a huge amount of data. We want to make sure that we're using it as effectively as we can. We're not getting into silos, which mean that we're having to sort of request information from people twice, or we're having to go around the houses in order to make decisions that we could make with the information that we have. Finally, our policy reforms. We're funding a number of things through this budget, things like the family hubs, which are really going to make life better for people. We're going to make services far more easily accessible to residents. Family hubs is an idea of taking council services from the town hall out into the communities, making sure that people are able to access them where they live. People coming in to ask about perhaps children's services, but while they're there, they can find out about housing services, about council benefits, about adult social care, and all of those things as well. So there's a lot going on. We're very proud to have been able to put together a budget, and I'll hand over to Sukhvinder, who'll be able to talk about it in a bit more detail. Thank you.
Please let me just a second. We've got Victoria with her hand raised. Victoria?
Yeah, I've got a couple of questions. Do you want me to ask now or wait until our presentation's finished? Can you hear me okay?
Yes, we can. We're going to finish the presentations and then we're going to move on to questions, if that's okay, Victoria.
Yeah, that's fine. That's fine at all.
Thank you.
Thank you, Chair. Good evening, members of the PAC committee. So the papers that have been sent out to all of you has got a detailed report that sets out in the greater context what Councillor Rhea has indicated about how the budget was put together, our priorities as a council, and there are lots of appendices about the detail. Prakash and colleagues from Adult Social Care and the Deputy Leader will talk much more eloquently about the details for the Adult Social Care Service. I'll just talk of the general approach to the council in setting the budget. So I've got a few slides. I won't be more than 5-10 minutes or so, just to highlight some of the key things for members of the committee. So first of all, I just want to say a couple of words about the operating context that we find ourselves in. Our operating environment is very difficult overall. Say something about the objectives of our financial plans that we've been developing and the strategy that we've adopted as a council to deliver those. Then say a few comments about our proposed budget for 24-25, and then finally a little bit of a medium-term look about the medium term and our prospects for the future on that one. So our strategic operating environment continues to be very difficult. Councillor Rhea has explained those. The economic turbulence, inflation, interest rates, the unemployment levels, 4.2% overall nationally, and real stagnation in household incomes are all putting pressure on public services and those services that residents, businesses and visitors to the council want to use. With that, we've got the continuing legislative burdens. I've mentioned a couple of recent acts there, the Environment Act, which is all about waste collection and how we manage that, and our Social Regulation Act, which is about housing service. They're all putting extra pressures on the council to deliver to those particular requirements. Increasing regulation, alas, that is continuing. This year we had the introduction of offlog on the back of all the other arrangements that we've got, the Quality Care Commission, the Housing Ombudsman, the Local Authority Ombudsman. They're all putting pressure on the local authorities and sometimes diverting resources from actually delivery on the front line overall. Uncertainty on the reforms of local government funding and finance. We continue to have annual settlements for our funding for the future years. And I think some of the reforms that the government has wanted to do about business rates, fair funding and social care reforms have always been deferred, so they have been fully completed. That creates uncertainty. And as a council, we need to complete some major projects that we're undertaking, particularly on Civic Campus, Hammersmith Bridge, which we want to fully restore, and building new social homes that residents of the borough do want. In terms of our objectives for the financial plans, I've listed some of those there. They really reflect the values of the council, the 6 values. I've just said them in a slightly different way. And Councillor Rhea has talked about those. For me, it's about protecting our key statutory services that we are required to do. The council delivers over 60 different types of statutory services. And it's very important that we continue to make sure that we discharge those appropriately. Delivering services that are valued by our residents and businesses and visitors, relating to safety, all the things that Councillor Rhea has talked about, home care services, supporting our school children, all the residents and businesses in the borough. Working with our businesses to promote the prosperity of the borough. The council has got a very clear industrial strategy set out. We're working with industrial sector, science industries, medical industries to attract inward investment to the borough. That improves the prosperity overall. And again, just to finally wrap up, we want to make sure that we are a well-governed authority overall financially and resilient. The external auditors reported on that at the audit committee last November. I'm pleased to say that they are comfortable about how the council is managing the finances overall. So just saying a little bit about how the council has delivered those objectives and those plans. I'm always staggered really when I look at the numbers, and they've summarized there on that slide. Since 2014-15, we've generated almost £118 million worth of savings, cutting out the costs that Councillor Rhea has talked about earlier, and we've done that through those corporate programs. We generate significant resources from our business partners and our developers through SIL and Section 106, over 100 million currently we've got available through that. We're trying to make sure that we recover all the costs for our services where we can charge for those. So the council is recovering almost £60 million of extra income from those areas. All those things help to make sure the kind of ruthless financial efficiency that Councillor Rhea talked about is delivered overall. And I've said a couple of things there about IT systems and also analytics and technology that Councillor Rhea has talked about. My intention is not to replicate what Councillor Rhea has already said. Just a couple of key pointers about the principles that we've used in setting the budget. 3% for pay, 5% for inflation. Current inflation in December is 4%. So I think they're reasonable estimates for us to go with. Significant investment in the priorities for the council, over almost £11 million. I'll say a couple of words about that later. The government overall in its national revenue grant settlement is assuming that local authorities are going to have to increase council tax by 2.99% and the 2% for the adult social care precept. And that's going to be something that they expect local authorities to continue for a good while. The public finances are not as robust as they could be overall. But there'll be more news in the spring from the Chancellor, I'm sure, about that. The borough is growing, so we're expecting more residential properties in the borough, about 700 or so on an annual basis. That means we generate extra income, but it does mean there's more services that we need to provide. So it's also making sure that we maintain some of our balances and our contingencies to ensure that we continue to be resilient as a borough. In terms of council tax, I just want to say a couple of words about that. The council has got one of the lowest council taxes in the country. I think it's the third lowest across England. Out of the last 9 years, 5 years, there's been a freeze or a reduction in the overall council tax. Had the council increased council tax in line with what the government assumptions were, council tax would have been almost at £1,070. So residents of the borough are benefiting to almost £200 a year annually from that. Notwithstanding that, what I wanted to emphasize is that there are a number of exemptions that the council provides. So 3% or 4% of our residents will be fully exempt, students, care leavers, and obviously we've got some vacant properties, though we're minimizing those. 11% of our residents will be fully supported through the council tax support scheme, so they will be paying not even a pound towards the council tax, and it's one of the most generous schemes across the council. I think Councillor Ree and other members spoke very eloquently about that at full council last week, so I won't repeat those here. 27% of our citizens will get a single person discount, and that's worth about £200 as well for those residents per year. So we only expect really slightly more than half of the people and residents of the borough paying the full council tax overall. And I've said earlier about the assumptions that the government has made in the long-term projections for that. Just to say a couple of words about the overall budget. So we've had significant pay and price inflation. That's going to increase our cost by £13.7 million or so. That's the 3% and the 5% we talked about. The investment, 11 million almost in new services. We've offset that by continuing to be efficient. Mostly those efficiencies have been generated through how we work with our partners and how we commission services and how we work with our contractors overall. But Prakash and colleagues will talk about those implications for the adult social care service in a bit more detail later on. And the other adjustments there result in an overall balanced budget that the council will be considering in February. I just want to say a couple of words about the overall savings proposals. So in total, they're listed on the next slide, but what I've tended to do is to leave that to the services to actually go through those. So if Prakash, if you flick through that one there. Okay, so that's a slide there which just talks about the 8.1 overall. So I've given an indication there across how they're going to be achieved. I won't go to the full detail here, but they're across all services, property rationalization, how we're generating more income, how we commission services, how we use IT, and how we invest in our services generally. But the more important thing to note is that the council will be investing almost £11 million more in those services that are valued and statutory we're required to deliver. I'm going to let the Deputy Leader and Prakash and colleagues talk about the first two: social care investment, transition service or adult services, 4.8 million extra going into those services. Homelessness, it's a real pressure across London. There are significant numbers of homeless people across Greater London. So the council will need to be mindful about that and protect those services. Children and school transport, we're going to be providing almost 550 school children with transport to and from their homes to schools overall. That's 100 more school children than we did the last year. So they're all investing in service that we need to do. Council housing services, rebalancing and investing a bit more in those services. The tenants of the authority do need to have a high quality housing, and we're going to work towards those. Family hubs, Councillor Rhea has talked about, and I've just got a bit of a wrap all about some other investments in our waste services, continuing the program for collection of waste through the wheel bin service, and also cyber security. Very, very important to make sure that our systems are secure. They can be very costly to rectify and remedy if things go pear-shaped there. So 10.7 million, almost 11, as I like to say, investment in new services overall for that. Just a couple of words about our reserves position overall. Very important that the council maintains those, particularly in these current difficult times. Our reserves are not out of kilter with other London authorities. In fact, we're probably slightly higher on those, but that's because we've managed our resources very well, as the council has done overall, as Councillor Ree has explained. We're also going to be maintaining some minimum balances for those emergencies and those issues that we want to raise. Somewhere between 19 million and 23 is what the external auditors recommend, and that's the balance that we will be using. And I'm pleased to say that we've not used any reserves to balance our budgets for 24-25, which a number of local authorities are doing. We are using some reserves, but they're specifically for some projects that are funded from those, like the IT replacement program. And I'm now on the last bit, just say a couple of words about the medium-term position. I think our operating environment will continue to be difficult. I can't see the economy generally, inflation, interest rates improving for at least another 18 months or so. But I remain optimistic that things will start to get better over the next 18 months or so. The regulation will continue, and the inspection regimes that we see, the demographic pressures local authorities are seeing, increasing pressures on adult social care, children's services and homelessness, they will continue here. But sadly to say that we've got at least a budget gap over the next 3 years of an average of about 10 million or so that we'll need to accommodate. So that gives hopefully the committee here a summary really about our operating environment, how we've put the budget together, what our key strategies have been, our financial plans for that, the investment we're putting into services overall. So we'll now take those budget reports and those proposals to full council after we've been through all the PAC committees at the end of February. Thank you, Chair.
Thank you so much. Are we now moving to the second part of the presentation, or do you want to take questions now?
I'm happy to take questions now if members have questions about the general budget setting process.
Okay, so
move on to more specific
let's do
questions.
that then. Let's do that. First of all, I wanted to thank you and the finance department for all the hard work. Thank you very much. I mean, we know how currently we've got a very challenging strategic operating environment. You mentioned inflation, interest rates, economic stagnation as well, and the challenges for our local residents. And you've put together a budget that protects as well our most vulnerable residents who depend on those services. So thank you so much. Thank you very much. I would now like to invite questions and comments, please. Yes, we had Victoria, please. Victoria. I'm just going to turn off my mic.
Yeah, I've got 2 questions, and I'll try and be brief. First of all, congratulations, Councillor Ree, on putting together this budget in a very difficult financial climate. It can't have been easy putting it together, and so thank you and the officers who supported you in that task. My question concerns social care. You won't be surprised to hear. You mentioned, your colleague mentioned that the council tax is £200 lower than what council could be charging. I realise that there is a need to keep taxes low, particularly when household budgets are stretched. But I wanted to ask all the officers and yourself, during the last financial year, how many people approached the council to ask for social care and were turned away because there wasn't enough money to pay for their care or received less care than they needed? And if the council tax was increased by, say, £50 or £100, how many of those people could have their needs met? My second question is, it concerns me that Hammersmith and Fulham is still the only council which doesn't charge for home care. I wonder whether the council maybe could appoint some kind of ambassador who could go to those other councils and stress them how important it is not to charge for home care, and encourage them to look against their books and see if they can find efficiencies which enable them to cut home care charges. So those are my 2 questions.
Thank you. Thank you, Victoria. Okay, who would like to answer those questions, please?
I think Rob, you need to turn me down. Not something I often ask for. Genevieve? Yeah, that's okay. I mean, I don't really need it. May I just make a suggestion? I think that what we had expected from the social care side is that we would get a chance to present the social care plan for the year and then take questions on social care. Now, I'm very happy for us to answer those two specific questions first, or if Victoria is happy to wait, we can go through that and take them afterwards. But it's up to you, Chair. But I think any more questions which are about social care specifically and not about the budget setting process, which has been handled so brilliantly by my colleagues here, I would say, let's save the social care questions till after we've had the presentation, because they fall more naturally into that.
I'm happy to wait to say
For
that's
your
fine.
suggestion, Councillor Coleman. Victoria, I think we're going to leave the specific questions relating to social care after the presentation. That's coming next, if that's okay with you.
Yeah, that's fine. Never mind at all. That's fine.
Thank you. Are there other questions? Yes.
I was very impressed by the report. The fact that this council, I'm very glad to say, is actually not facing what in effect is bankruptcy, unlike very many. And I think that's quite important to say to the general public. One thing did occur to me reading the paper, though, and it came in Rowan's introduction and was followed on, was about your phrase was, you've pulled all of the low-growing fruit so far. How sustainable in the long run is it to go for further efficiencies? Because in practice, if you've actually made all the efficiencies which you can make, and I appreciate you've done so with considerable success, how can this go on to a medium-term future? And I'm wondering, how are you going to tell the public what you've done, because that's quite important, out of transparency, and also to say that in a really, what in effect is a hostile environment for local government from central government, I think it's important to say that if services are under stress, it is not because this council is remiss in trying to offer the best it can.
Thank you very much for that. I agree with your comments entirely. I think you summed it up very well. A hostile environment that local government is facing from central government. I think we've seen in so many ways that actually local government is an area that central government just doesn't particularly care about. It's not something they think about a great deal. It's an area we saw during the coalition years that they thought they could just squeeze infinite savings out of without any of the responsibility for the lack of services then falling back at their door. And that attitude, sadly, has sort of persisted. Every year we get told by central government how much money we're going to have. It's called the Local Government Financial Settlement. And we used to get that in November. We used to get it for multiple years. We'd be told you'll get this much this year, and then next year you'll get this much, and then the year after you'll get this much. And it allowed you to plan ahead for what you're going to do in future years. For the last 6 years now, we've been given just a 1-year settlement. And to make matters worse, we now get that figure in the last week that Parliament sits before Christmas. This year we got it on the 18th of December. So we're trying to plan these budgets. We try and do it 4 years in advance when we're setting assumptions and trying to work out how much we're going to need for the future. But the final figure that we get for a budget we have to pass in February, we get right at the end of December. So there's no ideological reason why that should be the case. It's not a big government, small government thing. It's just a case of complacency. They just don't seem to care. You asked about the sustainability of it. That we've cut £118 million out of the council budget in the last 9 years. £118 million out of the budget that is now £198 million. You can't do that forever. You're absolutely right to point that out. We do need to see a change in the way that local government is funded and the attitude of central government to local government. It's not just liberal left-wing councils like us in Hammersmith and Fulham saying that. The leaders of Kent and Hampshire Council have written to the Chancellor to complain about the situation that they're in. Local governments around the country, whether it's urban councils, whether it's councils in the middle of the countryside, whether you have responsibility for social care or not, all sorts of councils now are failing. And it's because central government is essentially decided it doesn't really care about them, and it's prepared to cut the apron strings.
Could I come back on just one element? I know it's a very complex matter, local government finance, but it is for the public. And I think it's important to find some way of saying that you've actually done, in really adverse circumstances, you've done remarkably well. And to point out in practice that you're actually been given more and more duties to carry through by central government with fewer resources, and to place responsibility really where it lies. And I think being open with the public about that is actually pretty important going forward.
You're absolutely, you put your finger on another point that is very important. That's not just the resources, but the responsibilities. We're seeing more and more duties pushed down from central government to local government, and we're expected to provide these services. We're expected to meet these responsibilities without the funding that should come with it. The way that we try and communicate this to the public is, well, firstly through meetings like this, but also through the council tax booklet. So we'll be writing to everybody in the borough, setting out exactly where their money is being spent, what we're doing with it, and how it is we've gone about setting this budget. I think it's probably also for us as councillors to go out there and make sure that we're speaking to the public about the good work that we're doing and the difficult circumstances that we're in. But certainly from the council's point of view, the council tax booklet is the main way that we go about trying to spread that message. Thank you.
Sorry, can I just follow that up briefly? Sorry, I think it really is quite a core point that there is much that this council is doing, even if we just look at health and social care. The point's been raised about, I think it was from Victoria, about free social care. It's not blazoned high enough, hard enough around the borough. And I think just depending on the council tax booklet, which goes out once a year, is doing a disservice to services that are much needed in this borough and that are lauded elsewhere by campaigners who are campaigning for free social services around the country. I do think, I'm aware that part of the paring down of services means that some of those budgets are being cut. But as someone who gets very frustrated reading next door messages, that there's a counter tendency, and it has to be countered by the council, that in a way that will push, I think, the achievements, the notable achievements by this borough that are being recognised outside the borough. I think that's really important.
Yeah, absolutely. I do agree with you. I think, and I think again, you put your finger on it. You know, in terms of cutting spending in order to provide these excellent services, some of the things that we have to squeeze inevitably end up being things that don't have a sort of frontline benefit to the residents who need them most. There's also, I think, an important question about using council resources for appropriate purposes, right? We certainly don't want to get into a position where we're being accused of using council money to pay for political propaganda. I remember under the previous administration, you'd walk down King Street and there'd be big pictures of the deputy leader of the council hanging from all the lampposts. Wouldn't it be lovely to bring that back? But at the time,
I imagine it was the picture, not deputy was hanging.
Absolutely, yeah, absolutely. So we need to make sure that we're spending money on the most appropriate things, and yeah, I remember seeing those and thinking that's not a particularly good use of council money. That's money that could have been spent on, you know, abolishing home care charges, that could have been spent on feeding hungry kids, and so. But I certainly take your point, and I think. If anything, that as councillors, we should be redoubling our efforts to make sure that we're getting out and we're spreading that message around the borough and elsewhere.
And if I could just add to that, and by the way, we took the first thing we did once we cut the deputy leader face down from the things and took all the stuff that went through all the door, everybody's daughters. We cut council tax by 1% with that money rather than waste it promoting ourselves. When it comes to next door, which, as you know, is a beast unto itself, it's all very well for the council to promote what it's done. But the most effective messaging that goes on next door is when residents choose to go on there and say something. And when the budget comes out formally next month, it may be that certain residents would think it appropriate to go on there and point out, praise, perhaps even bravely, some of the things the council had done. But I'll leave that to those residents.
Thank you very much. I think that's an interesting suggestion. I've got a couple of questions, please. So it's about the uncertainties. No, and it must be very frustrating to have all those uncertainties when putting together the budget. I mean, I'm thinking in particular in relation to the Household Support Fund. So the DWP announces back in 2021, 2.8 million, which we used for our cost of living response. And now I read from the report that it's going to stop on the 31st of March. And I don't know if there have been any updates or not as to whether that money is going to be replaced or not. And I'm just thinking a little bit about the frustrations that this was bring when putting the budget together.
Oh, absolutely, yes. I mean, I was mentioning the chaotic way that local government is funded earlier. This is a prime example of this. You're at £2.8 million that we spent on the cost of living response. Some of the most vulnerable people in our borough, the people who are struggling most at a time when the economy is being managed so poorly. This money we've just been told it's gone, right? From this financial year onwards, we just won't get that. Now, we've put a lot of extra money into that. We found £1 million in last year's budget to spend on the cost of living. We've got people who rely on the support that the council's providing. Support that they wouldn't get in other places, but because we've been able to make these decisions, we've been able to safeguard this money, that we're able to offer this support. We've heard rumours that perhaps in the budget there may be additional funding for cost of living and for these sorts of programs. But the problem is that the budget doesn't take place until the 8th of March. We've got to set a budget in February. It just shows the complete lack of any sort of joined up thinking, any consideration that the government has for local government. We'll be looking at the services that we provide. We'll be looking at the money that we have to see what it is we can do to help those who need it most. But we're very much doing it with our hands tied behind our backs at the moment because of this appalling way that central government treats local councils.
Thank you very much. It might be very frustrating, and at the same time, thanks to you for despite facing these challenges, putting together that balanced budget. So thank you. And I've got one final question. Sagvinda, you alluded to the independent auditors. So who are these auditors? How can you please tell us a little bit more about how are they appointed and what do they look at and what were their findings? I mean, it's good to hear that they had no concerns as well, taking into account that we hear of other administrations that are struggling and have got some challenging times ahead. Yeah,
absolutely. So like all large complex organizations, we go through a process of checking our books to make sure all the money is being spent where it's supposed to be spent, and then we're getting the most efficient service that we have. But also we have somebody, an external, an independent body who'll come in and they'll do the same. So we're not marking our own homework. For us, the external auditor is Grant Thornton. They're one of the UK's largest audit firms. There's a just as a bit of a side note, there's a real shortage in this country of people who are qualified to audit local governments. There's, I think, under 100 audit partners across the country now who are qualified to sign off local government accounts. We're seeing some councils who have gone sort of 4 or 5 years without having a set of accounts signed off by the auditor. And partly that's because there are lots of very complicated issues that they're dealing with, but also partly it's because there just aren't the independent people with the skills to go through and provide these audits. we've worked very closely with Grant Thornton. We've provided them with all of the information that they've asked for as quickly as we can, so that they can get on with making their assessments. And they've given us a very good bill of health. Actually, they came and presented to the audit committee. You asked how the auditor is appointed. It's appointed by the audit committee, who sits independently of the council, who go through and check a range of reports about how the council's operating to make sure that it's all working as it should be. And the auditor reports to them rather than to us. If we were making the decision on who to appoint, there's a risk we could say, well, we won't appoint you again unless you say we're wonderful. But the way the audit committee appoints them so that it doesn't have that conflict. The auditor came and spoke to the audit committee, our audit partner. He said we're one of the best run councils in London. The issues that they are looking at before signing off the latest set of accounts are very small. They're always, in a large organisation that spends hundreds of millions of pounds, there are always questions about how we go about accounting for different things, and they're all, there are, I think, two slightly technical questions that we're still waiting on, but no, otherwise the audit is very good, and at a time when so many other councils are struggling, actually, it's very reassuring to have that expert, independent voice saying that things are on the right track.
Brilliant, thank you so much. It's very reassuring as well what you said, that they think that we're one of the best run councils in London. So that's very positive. Thank you so much, Sekinder.
Chair, thank you. I just wanted to make one brief comment. The role of the external auditors, who are really independent, is a very important one. They are there to provide assurance to the residents, to the members, to the public authorities that we do business with, developers, businesses who want to work with the council, that actually the council has got some very well run finances, and they can feel confident and secure in that. I like them to come and have a look at all the details, because I can sit here and tell you all the good things that the council does, but it doesn't carry as much weight as some of the external coming and tell you that the council is doing that well. I just want to emphasize that independence point and the assurance to the residents, visitors, businesses.
Fantastic, thank you very much. Definitely, that's very reassuring. The fact that also they're independent and external, it's great. Thank you so much. Unless there are other questions or comments, I would like to invite our colleagues to give us a presentation in relation to social care. Thank you. And Councillor Coleman, thank you very much.
I'll kick off, and then we'll have wonderful people from the team come in. I'm very pleased to have the opportunity to front this report. It has been, as my colleague Councillor Rees said, as Sekinder said, it's been a stinker of a year in trying to make the budget balance. I think I'll say this because the officers can't. I think the total ineptness and chaos of this incompetent government, the amount of money that they've lost for the country, has made our job and in setting the budget for the coming year more difficult than I've known it in my now 10 years as a councillor. It is a dire financial condition the country finds itself in. And when Councillor Rees says in a rather kind way that he thinks it's appalling how much the government dislikes local government, I would say that seeing as the government still relies on local government to provide social care and children's services and street cleaning and care, looking after people who are having trouble in the cost of living crisis, and public health and swimming pools and parks. Seeing as local government is providing all these things, and the government is happy for local government to do that, for it not to give the money to these services so local government can provide them across the country, is simply an attack not on local government, but on people, local people. And it's been, as I say, the most difficult year in the area that I'm responsible for, to both balance its budget and continue to set a good budget for next year, which enables us as a council to continue to provide care for free. But I'm very impressed by the way both that the officers have worked and also the officers in the finance department, so Wendy, your team has worked, and that we've been able to find the funding to increase by 4.2 million the money allocated to social care. And we are yeah, there's a lot of things that one could say. There are challenges coming up next year. The government still hasn't done the promised social care settlement. They're sorting out the problems in the country. We and everyone else is having to deal with that. The NHS continues to discharge people quicker than we think is safe. We have to deal with that. Our social care workers are providing care at homes. They're dealing with managing people's medicines. They're dealing with changing wound dressings, things which they never used to have to do in the past. And they deserve recognition and proper pay for that. And again, we're doing all we can in that direction. That includes paying them travelling time, but it is more and more difficult each year. And Rowan, you were very kind, Councillor Ree, you were very kind when you pointed out the government. You know, we're probably going to put up council tax by nearly just under 5%. That's not, whatever it's going to be. It's not us putting it up. It's a tax that the government is expecting us to levy on the people. So when you get nonsense like a 2% cut to national insurance, just remember that the 5% or whatever it's going to be where you live in the country increase in your council tax. It's all tax. It's all decided on by what the government decides there is to be spread around the country. So said that, as I say, we have nonetheless managed to achieve £4.2 million of growth. We are proud that we are continuing to provide social home care for free in this borough, which is the only borough in England that I'm aware of that does that. We've and you'll see, and I'm going to let colleagues talk about this, but we've made advances in other areas in how we support people with autism, with dementia, people who are disabled, adults who are disabled, children and young people as they move from children's services to adult services who have disabilities and who move from the services. So I'm going to stop there. I'm very grateful, though, to have such a tremendous team, Joe Beatty and Linda Jackson leading the social care, Nikki Langley, public health, and Prakash, who knows more about every aspect of the financial social care than I think anyone in the country, and we are very lucky to have. So over to them.
Thank you, Councillor Coleman. So I'm going to start and just say a little bit about our vision and priorities going forward. In no specific order, I think it's important to just capture that whilst compassion is always the top of the agenda in adult social care, post Disabled People's Commission and the independent living vision within it, our focus is very much on promoting independence, giving people choice and control. But within that, we're increasingly, as Councillor Coleman said, have to look at how we can do that efficiently. And so everything on here is really about delivering compassionate services within a very tight budgetary envelope. We do have Care Quality Commission coming in to see us at any point over the next 18 months. And I have to say, personally, I think we quite welcome that in Hammersmith and Fulham. It focuses the mind, and it's largely looking at what should be your business as usual. So quality and assurance of services with a specific focus on home care, but not just home care, is going to be top of our agenda going forward. So that's not just for the residents that are within the borough, it's for those that are out of the borough as well, who are furthest away from decision making. And we've done a huge amount of work over the last year around building trust with residents that maybe lack trust in public services. And we're really proud of that work, and we'll continue to work with those residents and with local stakeholders, including the NHS, to look at a whole systems approach to quality assurance, doing some real deep dive work to give you assurance as members and also our residents, particularly in home care, that our new providers, and there are many of them, are all singing from the same hymn sheet. They're all signed up to the vision of this local authority, and that they're putting residents centre stage in the delivery of their service. Similarly, on digitalisation and artificial intelligence, and Councillor Ree mentioned this earlier, we talked here about the front door, so that's very obviously the first place when you contact social care, the first person you get to. Actually, this is a much wider agenda for us. We know that if we can use AI and digitalisation, that we can prevent crises further down the line. So certainly in terms of dementia care, we've doing some amazing work with our wonderful Imperial Dementia Research Institute around how we can support residents at the earliest opportunity and their carers to remain in their homes with care around them that is of high quality, and once again prevent crises further down the line. Workforce transformation is another high on our agenda, and we think we're leading the way here. Integrated workforce development has to be the way forward, particularly with, enabling us to be able to access training online. You're no longer worried about the maximum number of people you can fit in a room. So I think integrated workforce development led by residents, developing and delivering workforce activities with the NHS, with the council, and with our voluntary and community sector partner, I think is going to be a really powerful piece. And dementia is the area that we're leading the way, and frailty are the areas that we're leading the way with there. The other piece of work that's very exciting for us, aligned to the primary care networks, working alongside our GPs, is neighbourhood working. And I think Linda mentioned this at the last PAC. We want to link in with the family hubs, which have already been mentioned today, to bring services out to localities. So that our residents know the social workers and they know the occupational therapists, and they have more meaningful relationship with them than maybe they do now. So it's trying to balance an efficient service with something that's more person-centred. It's not easy to square that circle, but that's our mission this year. Similarly, it's a manifesto commitment to better use some of our assets that are currently maybe being unused. We've got some fantastic buildings in this borough. We're keen to explore how we can bring them back into use, maybe for some of our silver social type activities where we're providing support for some of those residents that are most socially isolated, but also some intergenerational work, working with schools and working with our GPs again to look at how we can bring some buildings back into use, flexibly using some of our money, our very limited money, but also bringing together partners to act as little mini consortia to apply for extra money to bring into the borough. There's still external funding out there. And I think at times we need to maybe break down the barrier of us being seen as the commissioner versus the commissioned, and rather one very important key strategic partner working collaboratively with other providers to bring in as many resources as we can into the borough. I think we talked about transition, a real passion for Councillor Coleman. Many years ago, we had a wonderful transition task force in this borough and made great inroads in minimising the cliff face that many families feel they face when their children move to adulthood. We lost a bit of traction in COVID. We're picking it up at pace. We've got an excellent emerging relationship with children's services, and similarly, an excellent relationship with economy and housing. And I think bringing that whole piece together as to how we support young people into adulthood, get them into work. Most young people want to work as soon as they're able to. And into housing that enables them to live a gloriously ordinary life. And I think the last thing back to housing is many of our residents, not all, but of the 2,800 that we support, a huge proportion are also known to our housing team in one way, shape or form. So more and more we're working collaboratively with our housing colleagues to minimise the number of professionals that our residents need to speak to get resolution on some of the thorny issues that they face day to day. If I could move on to the next slide. Thank you, Prakash. You were ahead of me as usual. Just a few of our achievements that we're particularly proud of. We're currently co-producing with parents of older adults with complex autism, a day opportunities model wholly based on independent living, and minimising the risk of those young people, adults, going out of the borough at a significant cost, £3,000, £4,000, £5,000 a week, often Prakash and eye-watering amounts of money. Why would we be doing that when we can keep people local in the borough they're really passionate about? Many of you will know we achieved dementia-friendly community status last year. We're hugely proud of that. We're now in the second year of our dementia strategy. And this year, as I said earlier, we're working with clinicians, with residents, stakeholders, to develop integrated workforce development around dementia and frailty as our ongoing commitment to co-production in that area. We've just launched our All Age Autism Alliance, We're not going to be called a partnership board because residents have told us board is boring. And we should be equal partners sharing power and control. So our goal as part of that's a huge endeavour, an all age autism strategy, but taking the learning from a dementia strategy, we want to work in local neighbourhoods with our family centres, with our tenants and residents associations to develop a range of champions or ambassadors out there that will work proactively with us in co-producing the improvements that we require. We think we're going to make that's going to be a real celebration for us in Hammersmith and Fulham. And once again, it's a manifesto commitment. We're working with Action on Disability, a key strategic partner, and we now have 5 disabled residents on our independent living delivery group. They are going to strategically drive our co-production and give us the scaffolding in the organisation that enables us to focus our co-production activities across the council, working across services, rather than maybe children's or adult services, undertaking co-production activities on a relatively small scale. We need to scale things up. We need to get more people involved. We need to hear different voices. I've said a little something about transition, but we're really proud to have funded in social care a post-19 co-producer in Parents Active. And to those ends, Parents Active are working really closely with us to relaunch our approach on transition. We had a conference later last year, and now we're running a number of focus groups focused on information and advice, always critical to residents, where to go to get the right information to help you make the best decisions. And also to look at signposting residents to other services and support where social care isn't always the best option for them. Maybe voluntary and community sector partners that are out there that are better able to meet their needs. And I think the last thing is just to say something about compliments. We've received 174 compliments since April 23. And I will say, someone that's been here 4 years, I have seen a significant improvement in social work practice, and most of those compliments are about social work practice. As Councillor Coleman always says, it's often the people that you really want to hear from you don't. So I think we need to generate a culture where we receive more feedback from residents, that we maximise every opportunity when we're undertaking a review to get their real life experience, their real lived experience of how they experience not just social care, but the council as a whole. So we don't rest on our laurels. And I think you can see there we received 69 complaints. We do worry that people receiving free home care are reticent to complain. Taking Councillor Coleman's views here, one which I share. You don't want to complain about something when it's free, because it is quite a privilege to receive something for free. So once again, the piece on quality assurance in home care is going to be really integral going forward. We don't rest on our laurels in social care in relation to complaints or compliments. And as a senior leadership team, we reflect regularly at our weekly meetings about what residents are telling us, and always try to de-escalate complaints at the earliest opportunity by meeting with the resident and talking through what their experience is, always apologising because no one complains without a reason, and trying to seek a resolution. Thank you, Prakash. And I think Councillor Coleman's already covered some of these, as has Sukhvinder, so I won't cover them all. Linda was keen to point out that we need to stop referring back to COVID-19 at some point, but I think the volatility of the care market and our experience day in, day out in trying to secure high quality care at an affordable price, it feels quite important that we refer to COVID here, because it certainly had a massive impact, not just on the care market, but on our workforce and the wider workforce. Rapid discharge from hospital and the significant pressure day in, day out that we are placed under our social work teams and the NHS staff themselves does place further pressure on the system and on our brokerage team, who work relentlessly to try and secure the best outcomes for residents when they're discharged from hospital. The delays in elective surgery, I think, we're all reading about all the time in the press. But we work with residents every day that are awaiting appointments, awaiting operations, or awaiting news from the NHS. And I think it does, as Councillor Coleman said, put extra pressure on us, because often we are seen as the friendly face of the local authority. I do hope that that is the case. But extra demands are put on staff, which they just can't meet. They can't meet because it's not their function or their expertise. They also can't meet because they don't have capacity. So there are some issues there around reputation and our residents understanding the parameters of our role that is equally as important as us doing a good job. Talked about funding. We need more short-term and longer-term funding in adult social care, but we've got to manage with what we've got. And I think the demographic pressures piece is a massive piece for us. In transition alone, we're seeing a huge increase in residents transitioning year on year. And the complexity of those young people coming through, certainly in the years I've been working, many years, the complexity and acuity of need genuinely has hugely risen. Many young people with, for instance, as one example, autism, also have lived experience of mental health, and maybe that is a family-wide piece. It is becoming increasingly challenging and risky being able to safely support people. We've spoken about our ability to make further savings. We've got a fantastic infrastructure in place now, supported by Prakash and his team. We have a mandatory finance savings challenge meeting every single week. It's bedded down. We're really proud of it. And I want to reassure Sukhvinder and the councillors that it'll be going on and on and on and on, because we've got a bit excited and a bit competitive about it now. And quite aside of that, it's very much needed. And then I think the impact of cost of living pressures, which Councillor Perez referred to earlier, I think the impact on the care market is felt every day. And I want to just say it was quite reassuring when we got a lot of the providers together before Christmas in the Irish Centre, that we felt that there was a bit of a sense of war spirit. We're all in it together. We need to survive. You need us to do well. Let's come together and look at quality assurance, because it's in our collective best interests. But I think the market sustainability report and the significantly higher costs that we face are making every day quite a challenge for us as a service, and something that won't relent. I'm now going to hand over to Prakash to say a little bit more about the detail in relation to the finance. Thank you.
Thank you, Jo. So in terms of the spending plan for social care for next year, we've heard obviously tonight in terms of the difficulty in setting a budget, but in social care, we have worked closely with our corporate colleagues, and the proposed budget for next year for social care is £114 million gross. So that's 7.6 million more than this time last year. So I think there's quite a sizable investment, 4.8 billion in social care, 4.2 for home care, and another 600,000 for learning disabilities, 3 million for inflationary pressures, 1.4 million for additional grants, which I'll go into details in a minute. And then obviously, like all departments, we need to find efficiencies. So we're proposing £1.6 million of efficiencies. And again, I'll come on to details on the other side in a minute on that. The pie chart that gives you a flavour of where we spend the money, and majority of this is direct care for residents. The dark blue line, which is the care providers, are externally provided services. So the service like residential and nursing care placements are by far the largest budget with the number of residents. Home care we've touched on, home care and independent living. We give direct payments to a number of customers for independence, and extra care and supported living accommodation is the fourth highest budget within that pot. So 73% of our budget is spent by providers of care in the market directly for residents of Hammersmith and Fulham. We have a range of in-house services which make up 6% of our budget. The largest is our reablement service, which is an award-winning service. And predominantly this is for residents who are discharged from hospital and providing intensive support for up to 6 weeks on that. But we have a range of day centres also that are in-house provided, and our care line service that supports not just social care, but a range of housing customers as well. But we manage the budget for that. Also, for care in terms of provision is the supporting people budget, which is a floating support service for care and support needs, and the third sector budget. So when you aggregate those four sectors of the pie, 84% of the budget is protected for frontline direct provision. The rest of the 16% of the budget is obviously managing the service, the social work staff, the assessment staff, the frontline staff, and corporate overheads. So generally, I mean, we're proposing a budget that's 7.6% higher than last year, and this accounts for 18% of the total council budget proposed going forward to February's committee. Colleagues have talked about pressures in the market and the social care, and this little graph here does explain the kind of the social care spent in the key services, home care, care homes, and direct payment. In care homes and in home care, we've seen a marked increase in spend over the last 2 years coming out of COVID, 15 and 16% respectively per annum. Again, Joe's talked about the acuity of need of customers. So we're finding more customers coming out with a greater need, therefore greater cost. We've got more customers coming out at discharge from hospital, but obviously we are supporting as a London living wage provider or minimum wage provider for care homes that are not based in London. That is also adding to the cost pressures behind that. The acuity problem is particularly masked in the last couple of years, as we're seeing more and more customers higher needs in that. Our inflation pressures are masking 10 to 15% increases in the new customers that are coming through requiring need. Partly inflation, partly due to acuity of need. I should move to the next slide. This gives a little flavour. Sorry, it's a bit squashed now. It looked okay the other day in terms of the medium-term landscape for public health and social care. In terms of savings, £1.6 million in adult social care. Now, a lot of these colleagues have talked about, Councillor Reeve has talked about, so a number of them are working with our commissioning sector and for opportunities around there. A number are building on from previous years of continuous improvements of services, 750,000. The service redesign we've talked about is the reform agenda in social care for having one department as an all-day service working across neighbourhoods over time. So we're hoping to get some savings from that. And then we've set aside 250k as a saving for artificial intelligence. So some of the themes we've talked about are now materialising some saving proposals in social care. And similarly in public health, we're proposing just over £500,000 of savings towards the total savings for the council. And most of those are through market opportunities, through contract negotiations, or an internal review of services and proposed savings from that. On the growth side, on the investments, that's money coming into the budget. Like we've talked about, 4.2 million for the new home care and independent living contracts. They start from next June. Around that, and that's been through cabinet in terms of the process and how that's been brought through around that. And given the pressures from children to adults, or young adults coming across and transitioning in as adulthoods, we are proposing a new team to strengthen that service, and there's 600,000 proposed for that saving. I've touched on inflation being an issue across social care, across many departments as well. So next year we've got a budget proposed of £3 million of the total allocation, which is about 4% uplift. We'll try to manage that with a difficult market, but we have an additional grant which we can substitute relate to that, which is the market sustainability grant that comes into the budget and is ring-fenced for social care. That's started this year and will carry on for next year. So we manage both together as part of the inflation and supporting the statutory responsibilities to have a care market. The budget does carry a number of risks. There's a risk appendix behind it and there's some mitigations behind it, but we've touched on the demographic pressures, people living longer, that's coming through in the census locally here as well, learning disability transitions. We are starting a review of our health colleagues. We're just scoping out at the moment. And we put that as a risk there because there's going to be tight negotiations of trying to protect the Better Care Fund, which is a poor budget between our health colleagues and local authority budget. And our equipment contract is having a few teething problems this year. We are discussing with them generally how to resolve those teething problems, but have maintained it as a risk as we think that's going to take a bit longer to resolve. On to Joe in terms of the next slide.
Thanks, Prakash. This is a slide outlining public health achievements, really interesting things happening in the public health sphere. Procurement of a new integrated drug and alcohol service. We had separate drug and separate alcohol services. So it's now integrated and it's delivered by Turning Point. We have amongst the best treatment completion in London. We also have very good pickups from prison back into the community. Beat the Street, physical activity for children. So that will go live at the end of February, going to April. So all these things contribute to reductions in obesity, which prevents future issues with health later in life. We've commissioned the Listening Place, which is local, a fantastic suicide crisis service to do bespoke suicide prevention work with everybody, really. So we've commissioned them to do a widespread training of every single partner service area in which vulnerable people might be thinking about taking their own lives. So that's been really positive, and they're on Shepherd's Bush Road. So they are certainly very local to us, and they've really enjoyed working with us. In terms of flu vaccination and COVID vaccination in our nursing home staff, we are in the second year now. This past flu season has been the second year. We're already reaping the rewards of that in 2 nursing homes where they've really grasped the mettle. The performance and coverage of flu vaccination is up to 57% in some cases, and the NHS average is about a third. So we're really outstripping NHS performance there. Continuing on infection control, we have an infection control team of 2 nurses, which is excellent. And we're working really closely with teams across the council, doing environmental audits and getting ready for CQC inspection. And in fact, our nursing homes have been commended on their infection control as a result of having this in reach. The last point is about very vulnerable clients who live in our homeless hostels. So we had issues with people getting to see mental health services. So we've commissioned an in-reach service for complex clients with what we call dual diagnosis, where they have mental illness and concomitant drug and alcohol use. And that has really changed the whole provision of these really vulnerable clients. We have 2 nurses who go in, liaise with our mental health provider, and really just change the face of what these clients see, who were, I have to say, often ignored by traditional services. The whole point of it was to reduce emergency use. So going back to ruthless financial efficiency, calling ambulances, police, and other emergency services is a failure when it happens. But as a public health and a public service family, when we get together, put services where they're needed, it doesn't just reduce the distress for the clients, but it also helps all of our blue light services who were almost parked outside our hostels. So that's just a snapshot of a few achievements. Thank you very much.
Back to the pie chart for public health. Again, the proposed spending plans for 24-25. The gross budget proposed, we're still waiting for the final grant announcements, conditions, but the indicative grant is 24.3 million. So that's a £300,000 more than this year. We anticipate that to go towards inflationary pressures. This is a ring fence grant here. There's no council tax contribution towards this budget. Like I've alluded to earlier, there's just under £500,000 of savings from here to be reinvested back to meet public health outcomes. And the pie chart gives you a flavour of where we spend most of our contracts around that. The 4 up the top, starting from sexual health, moving across, account for 55% of the budgets on the sexual health services. Quite a lot of these services are run by the hospital services or the local GPs. lead borough, lead hospital Chelsea and Westminster, as we are obviously part of that borough arrangements around here in terms of closeness. We spend quite a bit of money through that arrangements. Then we have substance misuse that Dr. Lang just alluded to in terms of the rehab and placement service, and that's been an integrated drugs and alcohol service now with Turning Point. A range of service under behavioural change through health checks, smoking cessation, obesity reductions, and so on and so forth. And the last main big contract is the families and children's contract with our health colleagues supporting school nursing and children's services. The grey chart, which is under the umbrella of public health outcomes, is a range of internal services funded by public health. So examples include in environmental health officers, trading standards, air quality. We support, subsidise the single homelessness and rough sleeper services for public health funds. In children's, you've got family support and youth services. So all of that is made up into that block of services down there. And the smaller last percentage covers the management and projects around that. So some of those as need basis and demand base that comes throughout the year in public health, there's a budget allocated within that services. I think that's the last slide. It is indeed.
Okay, well, thank you so much for the very detailed report. Thank you for the long-term vision priorities, for the social care key achievements as well, the social care spending plan, public health achievements as well. It's been very thorough, and thank you to all the speakers in this agenda item. I would like to please request that we respond to Victoria's initial questions to start with, if possible, and then I'll invite further comments and questions. Thank you very much.
Can I just check, Victoria, that I heard your question correctly? You were asking whether or not we ever turn down residents in terms of care and support because it's too expensive.
Yeah, and also I was asking, I'm delighted that the council is carrying on providing free home care, but I'd love to see more councils following Hammersmith's example. And I wonder if the possibility that the council could do some outreach work and maybe send an ambassador to other councils to encourage them to follow what Hammersmith is doing.
Yeah, so if I could maybe take the first one then. So there are many times when care and support is too expensive. And the provider market is such that Prakash and I know that back in the day, when I first started in social care, Lisa Redfern used to have a view that any package of care over £1,000, do you remember, Prakash? We scrutinised every single one. And now, £3,000, £4,000, £5,000 a week is not unusual at all. So to give a straight answer, every time we're assessing a resident's care and support needs with the resident, we then look for the provision for them, whatever it might be, whether it's day opportunities or whether it's residential or whether it's links in to employment support. But we look at what provides best value for money as well as what best meets their needs. And we've got to balance that every single day. And it's something that we've worked really hard to train our workforce on. So back in the day, social workers saw their role very much as being around the statutory functions alone. Social workers now know they cannot possibly operate with that one lens. They have to have a varied focal. They've always got to be applying the ruthlessly financially efficient piece as well, because otherwise we'd be millions and millions and millions in debt. So how that translates to the conversation with the resident, Victoria, is we honestly say, you know, that we are employed by the local authority, and it's very important that we get best value for money for the public purse. So we explore all options with them. And as a position of last resort, when we've exhausted all other options, would we go for a particularly expensive placement? And if you ask our residents about that, Victoria, you may have an insight yourself here. The most expensive provision in 2024 is not always the best provision anyway. And the most expensive provision in 2024 is largely out of borough. So it is a huge incentive for us to work collaboratively across the council and with our stakeholders to identify pooling resources, pooling funding, joint solutions for residents that get a better value for money for the public purse and enable residents to stay local. I think that's probably the best answer I can give.
Yes, my question was really whether the council would help more people if the council tax was put up by, say, £50. Will there be more social care money in the pot, which can then be given to more people, so more people have their needs met?
I didn't really catch that. I'm sorry.
But what I was asking was, one of the previous speakers said that the council spends, so the council tax is £200 below what the government allows the council to raise. And I was just wondering whether more people have their needs met if the council tax raised, say, £50.
Yep. Sorry, could we stop the volume? Thank you very much. Yep. So the way that the cap on council tax works is that each year councils are restricted to putting council tax up by 2.99%. And then there's an additional 2% social care precept that could be added on. So that's money specifically for social care. So it's not the case that we'd be able to increase council tax by £50 in a year, because that would be above the cap. This year, you know, we are going to be going with the full increase that we're able to do because of the difficult situation that we're in. I think there's always a case of having to balance the money that the council would like to spend with how much money residents actually have. We know that it's been a very difficult couple of years for people across this borough. And so the considerations on council tax are really to make sure that we're not making that worse for people who are struggling.
And if I could take your second question, Victor, I hope that was helpful as the answer to the first. Can we be ambassadors for free social care across the country? We are, it isn't unknown and unremarked among other councils that we offer care for free. And we do every so often get a visit from a social care director, a cabinet member for social care, maybe a finance person, to come and see how we do it. And we talk them through it. It requires very, very, very strong political commitment from the leader of the council down. And it requires exceptional ability in terms of finance and the day-to-day management of the service. And it is more and more difficult all the time. And when they come to see us do it, they say, well, you do it and you manage to do it, but I can't quite work out how. Now, it may be, Victoria, that we are richer as a borough. It may be that we have fewer older people, but these days we have an increasingly older population. It becomes more challenging. But in terms of us becoming ambassadors and actually going out and proselytizing for this, we are, as I say, we have a richer borough. We have the third highest land prices in Europe. We've exploited as much as we can the development opportunities, the benefits that gives us. We have 4 care homes. We don't have 30, I think it is in Barnet, something like that. We have a different situation, and it would be, I think, for us impertinent and inappropriate to go and tell other councils how they should manage their funds, how they should manage their money. And I'm aware that in other, you know, this is, to be honest, this is something which I experienced Labour councils and Labour members, I'm speaking as one myself, care more about than Conservatives, and they do raise this. Some local Labour parties do make their local Labour councils' lives difficult by saying, look what Hammersmith and Fulham is doing. We don't do that. It's not for us to say what any other council should do. And there are some wonderful things happening which we're not yet able to do. For example, we offer free schools to everyone in primary, free breakfasts to anyone in primary school. Westminster, under a Labour council, is now offering free lunches, not free breakfast, free lunches. So each council has to do what's appropriate and necessary for its population. I hope that's helpful. It's not for us to go out there and make other councils' leaders' lives difficult when they have very different circumstances to deal with. And, you know, some parts of the country have been so horrifically left behind that they have virtually no money to do anything. If I may just close on one tiny thing, we also provide, I just want to draw attention to a couple of things that we still do as well, which are important. We provide a subsidised daily meals and a chat service, and the price of £2 for that hasn't increased for 9 years. And Joe mentioned Careline, which is a very important safety net, not safety net, a very important safety service for people. Again, we've kept the charge frozen for 8 years, and we provide daycare, and we provide short stay services, and we provide transport, and we do not charge for any of those. So I would love other councils to be able to do that. And I'm sure many of them do some of these things and are looking at it, but it's not my place to tell other people what they should be doing. It's if their residents choose to put pressure on them, that of course is a different thing.
Thank you very much. Okay, I would like to please invite Meryl of your hand first.
Just a quick one, and it really is in response to Victoria, but it also perhaps picks up Ben's point about it's not up to the council to be telling other councils what to do, but there is a campaign for a national care, support and independent living service. It's called, its shorthand is NACSILS. It came out of Keep Our NHS Public, which Hafson is affiliated to, and it has publicised up and down the country the fact that Hammersmith and Fulham Council provides free home care. So there is publicity going on over the country coming from campaigners, but people that are concerned should look up. I'll say it again, campaign for a national care support and independent living service, because I think that's one of the best ways of actually putting pressure elsewhere. I understand that it's politically unwise for councils to actually put pressure on other councils. They should be working more collaboratively than that.
Thank you very much, Meryl. Jim.
Thanks, Chair. And thank you for the presentation, which is remarkably clear. I read this several times in the last several days, and my brain really was having to go into overdrive, but your explanation really was clear and impressive. One thing that has struck me, and it's a question, how much of what you do is actually work which is covered also by the NHS? I'm just wondering how much cost sharing is involved, because much of what you do, for example, going into neighborhoods, meeting people in local circumstances will identify need, will actually answer need, but you will probably also discern unknown demand, and that is costly in itself. And that is actually saving money for the NHS. So I can see what you were doing, reaching out, and I really do applaud it. And I'm wondering about a reciprocal gesture from the NHS side, where you in practice, I think, are saving a great deal of money in a kind of prevent way for them. Are they coming back with budget sharing proposals to the council?
I would say that the partnership with the NHS is definitely developing really well. And one of the things that we've identified is that, I'll just speak plainly, sometimes there is a fantasy that there are many more of us than there actually are. So multidisciplinary team working has been around as long as I've been alive. And there is a perception that we'll be able to field social care staff to MDT meetings around a whole range of residents, if only we could. So this neighbourhood model is really about, one, trying to mitigate against too many meetings and not enough time actually finding solutions for residents, but also B, an early intervention model. So you get into residents sooner, they're not having to liaise with lots of different professionals and being passed from pillar to post. So I think that's a really effective partnership model with the NHS that will reap dividends for us all, given that budgets are not only tight for us, they're also tight for the NHS as well. The wider questions around pooling of money, I'll maybe pass to others.
So it's an interesting one. If we save the NHS money, or as Nikki's been talking about, we may save the police money as a result of the excellent mental health work that you're doing. Do we get to see any of that? No, not really. And the whole way government works is silos, and it's therefore it disincentivizes people to work well together. However, since COVID, we have worked much better with the NHS. Indeed, the NHS and the councils work better together during COVID than they ever have. Everyone talks about learning from COVID. Keeping that going is a challenge. The NHS is a nightmare organisation to deal with. It's top down. Nobody sort of dares to fart in Hammersmith and Fulham NHS unless they're allowed to by Whitehall. Whereas here we make no such demands on our staff. We're very bottom up. I said that was a bad pun. Thank God this isn't being taped. Yeah. So yeah, but it is challenging, Jim, and you know this. The NHS is itself at the moment trying to make 30% running cost cuts across North West London NHS. We are getting some money from them through the Better Care Fund. We have to battle every year. They are meant to pay for certain things under continuing care. We have to make the case that they should be paying for things we're not. So it's a constant push. And the NHS itself it does things which I think are simply foolish. It decided some years ago to save costs by stopping funding podiatry, everyday podiatry for older people. As a result, I'm sure there are far more people going to hospital with ingrowing turn, unable to walk properly, which of course means they have falls in the home, so they have to go to hospital, and there's emergency podiatry. And I very much doubt whether they've ever actually counted the cost of the two. So there's not just things about the NHS and the councils working together more, it's how the NHS itself works. Last thing is, they understand us even less than we understand them. And I think there has to be a lot of work done by the NHS to understand. For example, Joe gave the example of, they expect us to be able to turn up at every meeting. Although I have to say, when it comes to transition for disabled children to adulthood, the NHS is too often not at meetings as well. They don't understand councils. We don't understand them perfectly, but we understand them better. And this is a constant refrain of mine at the Integrated Care Board on which I sit. So that's it. And I have to just finish by saying, I think you're probably the only member of any committee, Rowan and Sukhvinder, you can correct me on this because you're going to every committee, but there are very few members of committee who said, I've read this several times over in recent days about the budget. So I think you get top marks for that. Thank you.
Can I come back in a second? Actually, I did appreciate the pun. I grew up in the west of Ireland watching Carry On films, full of those kind of jokes. I really loved them. I was going to ask about neighbourhood teams, because that actually does strike me as a way of reaching for what should not be called hard-to-reach communities, ones where people haven't done the work in the past, or like part of the NHS. But that must be cost-heavy, because I can well imagine a model where you actually sit in the town hall and you send things out. Doesn't cost as much as having a team on the ground, making sure people work together. I'm wondering there about the kind of pressure, and again, it goes back to cost saving, that you can bring in the borough-based partnership and that part to share staff, to pick up on things you notice. For example, I know very poor housing is a driver of very poor health. And if there's an equality tick box in every NHS paper I read at the moment, that's on every one of them, that's an obvious one where you'd actually say, can you work with people, with councils and other providers? And there must be comebacks there, which you can demand from people who, in practice, are having money saved for them by you reaching out.
Yeah, thanks, Jim. We've got some really good examples actually where the NHS has funded extra posts. They're funded 2 extra social workers working with the hospital team. They've funded part-time post in housing. At discharge from hospital, one of the greatest blockages is a housing related. People can't go home because they need a deep clean. That's a classic. They can't go home because they're perceived to be a hoarder. If everyone that was a hoarder, we'd have about 18,000 hoarders in Hammersmith and Fulham. But perception versus reality is quite interesting. But I think housing is the common denominator of issues. certainly in relation to hospital discharge. And I think there are more opportunities, I think, to grow that joint funding of posts that would unblock some of our biggest knots. I mean, Nikki's got some good examples as well, where Nikki's found solutions that would enable residents to get where they need to get at the earliest opportunity. Can you say any more?
Yeah, I think it's something that that's why I love working in the council, is those networks of interested individuals where you have someone who either is homeless or is having trouble coping. Housing is an element, mental health is an element, there's some physical issues, GP knows them really well, adult social care as well. And it's that sort of light bulb moment where we all get together and we say, oh, I know Bob really well. What if we put him somewhere else? And then he'd be really happy and his mum's work. You know, it's that together, public services is magic. And then we start talking, some of the posts that are funded in the last year are extra OTs in housing so that adult social care are embedded in, and it's making it so easy. We've had a social worker who goes in and says, I know this lady really well now, boom, 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 it's all she needs from housing. So then you don't have a housing complaint. You know, it just makes it shortcuts to effective public services, which I love to see. It's just these small tweaks make a huge difference.
You're talking about breaking down silos within the council, which I have to say you're
And
incredibly good at,
yeah,
and between organisations as well.
Yeah.
Just one remark, when we meet with Imperial management, which we do on a regular basis, discharge for this council comes up as a real compliment as against any other council in North West London. And that's unsolicited by us. It spontaneously comes from Professor Orchard and his team. So that's a model of which I think he is trying to lead in other councils to adopt, to copy from here.
Thank you very much for that, Jim. It's very encouraging and reassuring. It's really good as well to hear such positive feedback, and it's to have a council as well that is referenced as a good model to follow. So fantastic. I've got a couple of questions, please. Do you have a question now? So I commend the council and the service for its commitment to quality assurance services, and I noticed as well how you're all getting ready for the Care Quality Commission audit that's coming in within the next 18 months. So I think that's really positive. You also alluded to the key achievements and how you want to learn as well from complaints. But I note as well that there are lots of compliments, which is fantastic, and I celebrate that. In terms of the complaints, so you alluded to how you all come together and discuss some of those complaints. So can you please tell us a little bit more? How do you go about analyzing these? Are there emerging themes, and are they used to improve the service? So they're used to improve the quality. Thank you.
Yeah, so when we first heard that we were going to be Care Quality Commissioned, we put a series of deep dives in the diary. So we've done a deep dive on pretty much all of our areas of service delivery, from how we manage risk to, we haven't done home care yet, actually, to brokerage, how we commission, safeguarding, transition. I could go on. I think we've 10 or 11 so far. We've got another 10 or 11 to go. And they're fantastic ways of bringing officers together in social care to just do a bit of analysis. So look at the data, look at the qualitative comments we've got. So in the issue around complaints or compliments, you've got the qualitative information, because that's what it's all about. And then just think about, why is this, what are the trends? How do we fare alongside other councils? All the stuff you'd expect for you to do in a deep dive. In terms of complaints, we've got an excellent complaints manager in terms of Nigel. I think many of you know Nigel in adult social care, and he's been around a long time. He's very, very experienced. So we theme the complaints according to the team. So whether it's learning disability transition, so on and so, commissioning, so on and so forth. And then we have an annual report, which we bring to our senior leadership team in adult social care, which is not just assistant directors. We've now got heads of service and strategic commissioners, CQC lead on there, transitions lead as well. So it's a service-wide bit of reflection. But in terms of the learning, well, there are always common themes with complaints in adult social care and within children's services as well. And the big hitters are always around delays in getting assessments, so waiting times. They're about being able to get to the right person efficiently. So, you know, not being passed from pillar to post. Occasionally, there's been a huge shift in this, but in terms of the quality of the response from the social worker or the member of staff, we're not all about social workers, as you know, in social care. So language, tone, politeness, respect, those things, really critical for us as well. And also about, as you all know, about the quality of the service received. So I would say they're the four. And I think the three main ones, the fourth one is about the way in which residents are perceive our officers of the council. You know, are they polite, are they respectful? But the big ones are about delays, getting to the right person quickly enough, and quality. So it's really helpful having the deep dives, because there's an interdependency between all the deep dives, obviously. So the complaints and compliments obviously impact on, you know, how do we commission services? And with Councillor Coleman at the helm, the scrutiny on how we commission services, what do we ask for? How do we monitor how they deliver what we've asked for? Do we do spot checks? Do we have in-depth conversations with, the people that receive those services? Do we go back and follow up? You know, that really systematic, methodical, culture-wide, service-wide, whole service approach piece. And I think we genuinely have a way to go. And in fact, we had the conversation with Councillor Coleman only recently. I think it's easy in social care to be a very reactive service, particularly in an ambitious council like Hammersmith and Fulham. You're not a leadership team as councillors that expect us to be relatively kind and compassionate with our residents. The ambition is that we'll be very person-centred, and we are. But we've also got a number of other pieces that we have to deliver on. So sometimes getting the balance of how we respond, never dealing with widgets, never dealing with widgets, we deal with real people. Apply the principles of treat people how you'd want to be treated yourself. Having Sukhvinder and Prakash in your head all the time, ruthlessly financially efficient. You've got all of these different things. It's a huge jigsaw. It's the most ambitious council I've ever worked in. And I think that with that, comes some challenges. However, on home care, we are, just saying it very straightly, we're exposed as a council because we're the only council in England providing free home care. So it's got to be good. It's got to be good. Councillor Cowan and Coleman, with our residents, fought hard for the free home care. Residents are so proud of it. Speaking to Kevin Caulfield and Tara, they'll talk you right through the journey. Immensely proud of it, of that achievement as disabled residents. So we need to really grip it going forward, and we need to give you assurance and our residents assurance that we've got that very business-like approach to how we manage quality assurance in home care. So the deep dives, like the mandatory finance meetings, I think become part of our culture now. We're really enjoying them. We're enjoying the different lenses on how we're doing, what we're doing well, and what we need to do to get better.
Thank you very much, Jo.
Could I ask an additional question? It's not you haven't got enough work to do. It's a building trust type question. Looking at really comprehensive figures, but also going to NHS meetings where at least the acute trusts at the moment are actually doing very good work by identifying communities, particularly ethnic communities, in both provision of services towards and take up from. I'm wondering, is it possible to build in an element of that in future years so that in talking to residents, we're actually able to say, these are the communities we're serving, we have further to go here. And I know in methodology, that's probably not simple, but I think actually building confidence and support, it could well be very useful.
I'm happy to have a look at that. I think in our care system, when the recording is done on the assessment or a review, the ethnicity is requested. If it's completed all the time, I'm not sure, but we can definitely have a look at that. And then from that, the care system generates a care episode, which is the type of care that the resident will need through that. So we can wrap the two together in terms of, and then from that obviously gets a spend value. So we do have a system that's singing and dancing. Whether it's recorded is what I need to check. How frequently?
Okay, thank you so much. Are there any other questions, comments? I'm checking as well online. Victoria, no? Okay, thank you very much. Okay, well, first of all, I wanted to thank Councillor Ree, Councillor Coleman, and all, first of all, for setting that budget, just to repeat what we said before, challenging times and putting forward that balanced budget as well, protecting our most vulnerable residents. So thank you to you, and thank you to the finance department for that hard work and for putting forward a very good budget for our residents. Thank you as well to the service as well for the presentations and the very detailed reports under the leadership of Councillor Coleman and all the hard work of officers. I mean, for me, it's important just to remind people how we're the only council in the country to abolish charges for care for disabled and older people at home, which makes it, I think, one of the best boroughs to live in. We also hear about the commitment that we have to quality. So it's not only about that free service, but also about the quality of the service, making sure that it's a good quality service. Also, a budget that subsidizes those daily meals and a chat, £2, and with no increase in the last, I think, 9 years. We offer a subsidized care line service as well. And well, all the other highlights that we've heard of this evening in terms of the public health achievements and also the other social care achievements. So I think it's very good. So in terms of tonight's request that we have as a committee, it's on page 24 of our report. Are we happy to agree those recommendations? Good, great. Okay. Thank you very much. Thank you. I would like to suggest just adjourning for a couple of minutes, please, while we allow our colleagues from finance to leave and rest. Yes, I come for a break, please, for 2 minutes, please. Thank you. Okay, thank you. Okay, colleagues, can we please start again? Thank you. Let's go, let's go, let's go. Okay. Thank you very much. Let's move on into agenda item number 5, a public health update, and we've got Dr. Nicola Lang for this agenda item too. Thank you very much, our Director of Public Health. So over to you, Dr. Lang.
I won't belabor it. We've all seen the national media, large outbreaks of measles in the West Midlands. However, we do have outbreaks in Northwest London and also one South London borough. Measles is back, and London is certainly a sitting target for measles because it's very under-vaccinated. We are very similar to the London average. Only 73% of our children have had what we call MMR 1 and 2 at age 5, and statistics don't change very much. It varies by GP practice, and the more deprived and ethnically diverse residents are less likely to be covered.
Sorry.
Oh, sorry.
Just
maximize. Oh, I did the wrong thing. Oh.
Okay. No, you're fine.
Okay, excellent. Good. Yeah. So the next slide is one that you may have seen before. Essentially, the thing to hone in on is the 73%, but to put it in terms that I like to say is 1 in 4 children in our classrooms are not fully vaccinated. That sort of brings it home a lot. And then the other bits of the graph just show where we compare to other London boroughs. Councillor Coleman referred to it actually at the November, his PAC is, you know, why are we bad? Why have we consistently been bad? We've been unearthing some interesting material, which we'll get to at the end. So I feel that we have more staff now to work on measles in my team. But just to give you a sense of it, because I've been reflecting a lot on measles and low MMR uptake. There was a big exercise in autumn of last year, and speaking to our school-aged vaccination team, it's called SAIS. They rang thousands of children and the uptake was incredibly poor. So even having a nurse phoning, we had not much. So it's a vaccine that people are not interested in. So there's very little demand. Oh, number. No, 10 children. Yeah. So not much output for huge effort. And we know that with bush doctors, actually working with Vanessa and colleagues, we did a piece of work in 2022 where we rang 800 parents of unvaccinated children. And I think the conversion rate was something like 6%. You don't get very far with, and when I say conversion, it was, I'll think about it. It wasn't even a vaccination, which, and bush doctors is, you know, we speak with them a lot. We know them very well. So it's you know, it's something that I grapple with all the time because immunizations are so important. We can give you a flavor of what we've done. It looks like a lot of activity, but I think the interesting thing is I can say, yes, we were offering MMR, but the mums did not want the child to have MMR. They were very happy for nasal flu, but not MMR. So this is really just gives you the idea of activity. Just to not forget homeless clients, we've got regular health events. We had the monthly last year. That's working really well. But child immunizations is quite special. You know, to let you know, we work very closely with our asylum settings. We've got a lovely bus coming on Valentine's Day to do all our asylum kids because we know we've got 60 children in one particular venue I won't mention. So that's positive. That will probably be taken up warmly. What we're doing now is working with our wonderful colleague Nadia Jazza Early to link vaccination pop-ups with warm welcomes, warm welcome spaces. Again, let's see how it goes. Let's see if there is take up. And then I had a fantastic visit to Our Lady of Fatima Church 1 week ago or 2 weeks ago. We're planning to do a lot with Father Nesbitt, who I think is absolutely fantastic, and thinking about his Wednesday children sewing with parent events, about having a pop-up there, because Father Nesbitt told us it's called the Holy Mile on Commonwealth Avenue, which I absolutely love. So we've got Egyptian House, St. Michael and St. George, and then Our Lady in the middle. Yeah. And we're doing food work with Father Nesbitt, you know, ... more to come on that. But it's linking all of it. It's having a meal, feeling welcome, and then getting vaccinated. And as Father Nesbitt said, he said, people were a bit wary a few years ago. They lost their trust. He said, we're now at the space where we've built their trust again. So these things take time, even when, you know, the Catholic priest says it. I was surprised. Anyway, data cleansing is really interesting, not interesting to a lot of people, but we love it. We think we have discovered some data cleansing issues, certainly on flu, because we are such an outlier in Northwest London. So we are now having some discussions with the data folks at the ICB. So we think vaccinations that have been happening in some hospital settings have not been recorded on a patient's records in the GP. So positively, they've been done, but they're just not noted down, because we are so bad that I asked one of our nurses to look into it. So we're creating some good relationships and seeing if we can improve it. Similarly to school-aged vaccinations, I'm not going to get my hopes up because it's not measles, mumps, rubella. The school-age teams do things like for cervical cancer, it's called HPV vaccine, and ACWY, which is meningitis. The school nurses are also saying, I did thousands of vaccinations, but I'm not seeing that on your records. So data cleansing, I'm hoping, leads to some movement in our very poor performance. And then the bit that, you know, I'm thinking about it all the time. I was thinking about it when I was off last week as well. We need to start building on the work of what Councillor Coleman did on building trust, and really start maximizing those assets. So we've been working for the last 6 months on sharing information on infectious diseases, including measles, with our imams and church leaders. They now know us even better than they did in COVID. Tomorrow we're Al-Manar. I know it's in KNC, I know, but Al-Manar Mosque is very friendly to us, and all our imams will be at Al-Manar tomorrow. So we're continuing the dialogue. We're going to do a twist on, I know Councillor Coleman, you mentioned Brent doing videos. We're going to do a twist on that. We've done talking head videos before. We're going to have members of our faith community questioning us, so that the balance of power is in their lap, and then we're hoping so that they can sort of prod us and say why. And then I mentioned the warm welcome in tandem with vaccination. We're also planning some work with the Building Trust group, and watching this space. Our very dear friends at Imperial A&E, we are, I don't know if I should say now, we are thinking about opportunistic vaccinations in A&E, which is a huge breakthrough. If we can't do it one way, we will do it another way. And we are always so grateful to A&E doctor colleagues and nurses. So that was it really. But yeah, what Jim's challenge, what changed? We haven't had any success with Councillor Coleman's really good challenge of a community pharmacy. That dialogue rumbles on, but if we can do the A&E opportunistic vaccination, data cleansing, and maybe instead of the supply issue, the demand issue, helping our faith communities. I should have mentioned the pig and the non-pig version as well. We're learning from Birmingham every day to say, don't worry, ask for GSK, GlaxoSmithKline, Priorix, no pig in it. And we're also going to ask the imams to say it every Friday. So thank you very much.
Thank you very much, Dr. Lang. Are there any questions, comments?
Just one comment on the measles.
Yeah.
The comeback of measles really is dismal.
Yes.
And I noticed in this week, reading the Irish, the French, and the Spanish media, they've remarked on the UK suddenly becoming what they thought was past tense. I'm curious about the pharmacies. Why has no progress been made? Is something not happening from their end, or?
No, as usual, when working with pharmacists, they want to do it. They are so keen. They are my best partners. I communicate with them almost every day. They are terribly keen, but I'm going to try to say something that sounds like nothing. Systems and governance, you know, the usual, it's too difficult. We will get there one day. I see there's been media coverage of it's rising higher on the agenda politically, but yeah.
I'm going to be cheeky here because I haven't had a chance to speak to you about this, and I wanted to, so we're going to have a chat behind closed doors in public. At the Integrated Care Board meeting the other day, I raised this, and there was somebody who was at our meeting, the last PAC meeting, and they suggested that progress was being made. Someone else suggested afterwards it wasn't. Has anything happened since to actually move this forward? You talked about governance issues. They're all NHS governance issues. Has anything happened to move this forward since our last PAC meeting so that we're any closer to getting pharmacists able to vaccinate children?
No, nothing tangible. The willingness is there. The response that we have every time, you know, I say our lead politician, the response is always, yes, we very much want to do it. I don't doubt that everyone very much wants to do it. I think probably the systems aren't in place to do it yet.
If everyone wants to do it, then I guess if something's difficult, you identify, and you really want to change things, you identify the difficulties, and then you work out how you can overcome them. And maybe you work long and hard and you find some of them are insuperable, but you have to actually identify the difficulties, and then you have to want to sit down to overcome them. So have they identified the difficulties yet? They seem to have said, there seem to be lots of computer says no at the last meeting, governance issues. So if they really want to overcome it, you would have thought that they would be sitting down to discuss how those difficulties can be overcome. And are you aware of that happening?
I'm not, but I will check again for you, Councillor Coleman.
Thank you very much. I think this is brings me back to some of the actions from the last PAC, and I'm just going to remind us all what these were. They're on page 10 of our report. One of them is to agree a community vaccine location in the borough, to provide a list of vaccine locations following the meeting, to take forward the request to be part of the Vaccines for Children pharmacy pilot, which we already had an update, and to create a working group to look at improving vaccination rates. So just as a reminder to make sure that in line with this agenda item, then we may follow up any actions in relation to this as well that can improve as well our vaccination rates at local level. And I appreciate all the hard work that's been done at the moment. So thank you so much. And I appreciate that there have been some challenges, but I note all the efforts and how you're working in collaboration with other stakeholders to make sure that we improve those rates.
Just on that, is there a children pharmacy pilot?
Not that I know of.
All right, let's talk about writing someone a letter.
Let's just follow it up in the next few weeks.
I think this I hope that we can do is working together. We can make some progress.
Yeah.
We need to give the NHS a chance to act on the desire that Nikki says they have to make progress. Dr. Lang says they have to make progress. And then I think bring them and the subject, and then back to the committee.
Okay.
So we'll keep you informed, Chair, about the progress we're making to find a suitable time for that to happen. But it is extraordinary to me, and as it is, I'm sure, to you all, that we had that really quite punchy meeting, that now it's all over the press, that there's panic in the NHS when they go out and they cover, and all the news stations are covering the fact that people aren't getting vaccinated for measles, and that we are still confronting governance issues and the sort of thing that COVID enabled us to overcome, we can't overcome. Again, it's just, and I need to understand where the blockage really lies, because I know there are a lot of good people in the NHS who'd like to do something about it, but I think we have to work on understanding where the block really is. Yeah, and try and unblock it.
Great. Thank you very much. And thank you again, Dr. Lang, for all the hard work.
Thanks.
Are there any further comments or questions? Or are we ready to move on to agenda item number 6? Oh, yes, Meryl, please.
I don't know whether to wait to item number 6 because there's an overlap between item 5 and item 6 in terms of what I want to say. So will I? I think Nikki needs to be strongly commended for what she's just reported, which shows a real willingness on the part of Hammersmith and Fulham Public Health to take up those issues that we have been pushing on for, I hate to think how long. It's years. It is years. And not just here, but I mean, Ben's talked about him raising it at the ICB. Jim and I have raised it long before there was an ICS at CCG meetings, and we're still nowhere. And that is entirely frustrating, but it's also not good for the health of the borough. And it's not just the MMR vaccinations, it's much wider than that. But there are other concerns, and some of those have to do, I think, with how the Hammersmith and Fulham Health and Care Partnership is or is not developing. The borough may have a different view from residents, but I would want to suggest that residents don't necessarily have very much notion of what a health and care partnership is, unless they're as engaged as people like Jim and I are in the NHS. And I think if this is a scrutiny committee, then there is a real need for looking at the health and care partnership as part of the scrutiny's remit, which probably means looking at the borough side of it as well as the NHS side, because it is meant to be a partnership. But I think there are a range of issues, vaccinations being one. Community pharmacies have come up before. I can't read my notes. PCNs, where patients don't have a clue by and large they're part of a PCN. And Ben's also mentioned the fact that the NHS and local authorities don't really understand each other, and I will confirm his notion that that is right, having been to council meetings and NHS meetings for a very long time. And I think it's important that what one looks at is how the health and care partnership in Hammersmith and Fulham is actually working on a partnership model. It actually talks, we hear a lot of talk from the NHS about co-production. I've never seen any real indication that co-production is working. And it talks about engagement with residents and so on. And I don't know that residents really know about it, let alone actually feel that they're being engaged with. And I think those are really key issues. And how it's publicised is also very much part of that. And I think now is a very opportune time to actually be looking at this, because on the one hand, we know that the ICB is cutting by 30% its funding for doing things. But at the same time, in our meetings, Hafson's meetings with the CEO, Rob Hurd, he is still talking about the need to push things to the borough-based level. Now, if that's the case, I think we need to actually, as a scrutiny committee, be pushing to see that it is a powerful borough-based health and care partnership, rather than something that seems peripheral to what's going on in terms of health and care in the borough. So I would like it to be a major issue for discussion at a fairly, a new, in one of the more recent to come meetings. Thanks.
Thank you very much. I'll come for a comment.
I'll make a stab at answering that, if I may. So there's different things going on in what there's so much in your question. So I'll try and unpack little bits if that's okay, and if I got it right. There are issues, there are things, what do you call them, medical, there are conditions, whether you could be talking about tackling dementia, we could talk about measles, we could talk about mental health beds. There are specific issues. And then there is, which are, you have to ask yourself, and the question would be, is the ICS going to address these as a system more effectively than they were being addressed before it came into being? Then there is the question of how it works, whether it addresses A, B, C, or D, how does it work? And you've got all the different parts of the NHS, which aren't used to working well together. You've got the hospital trusts, you've got the mental health trusts, you've got the primary care, you've got the GPs, and then you've got, which join together in primary care networks. You've got the other bits of the NHS, that what you might call it the sort of vertical integration. That's not good. And they're all uncertain, and they're all, there's a lot of language about cooperating, but as from the outside, I've no idea how well that's working. And you have, of course, with the council operates alongside each of these individually. We work with the primary care networks. We work with the mental health trust. We have challenges there. We discuss this with them. We work with the hospital. We're very, very successfully, particularly with Charing Cross. So we have our own individual relationships with all the parts of the individual parts. And then we have to integrate, we have to work with the borough-based partnership, or the health and care partnership, as we call it here, which Joe tells me is all right. It's got some successes and some bits. It's like everything, a bit of a cure. It's egg, I suppose. So what challenges me in answering your question, because I think a discussion in public and some questions, is how we structure the conversation, the questioning to be had at this committee. Because there are so many different bits that we can find ourselves going down a particular rabbit hole and suddenly not addressing what isn't, what we suddenly strikes as the most important bit. So I'm wondering how we structure that conversation.
Just if I can come back quickly, Ben, part of your, I wasn't really asking a question. I suppose I was posing some statements about a topic to be on the agenda here. But some of your response to what I was saying was about the ICS at its big level. And actually, of course, those are important issues, but actually I was trying to focus on the local health and care, the HFHCP, I think I've now got it right, for a number of reasons, but a big reason is, A, I have major concerns that it's not working. B, I've seen work done in, for example, Brent, where things do seem to be happening that involve people that may even be called co-production, but I don't know how widely it's happening in Brent. It's just I've been at meetings where things have been presented. I go to a lot of meetings, some of which are local meetings, but I get no sense of, I mean, it's by chance, I get no sense of a coherent Hammersmith and Fulham health and care partnership, let alone what issues are being dealt with. And I think that that is something that is not good for either the borough or for the NHS.
So, I know Jim wants to chime in just on that. If I may, thank you for clarifying that. I think that's it then. But let's start there. Let's start talking about the local cooperation, where it's working well, where it's not working, how it's working. What would be helpful is, I think, and we'll take that. We just talked about that. We'll take that. I think we'll all learn from that. What would be helpful is to have a few questions in advance, if you'd like to share your thinking, if the committee would like to share their thinking with us on the sort of things that the presentation should address, and then we can explore it deeper in the question. Would that be a good way forward?
I think that would be an excellent way forward, and it would be useful if it doesn't add to David's work, if an email could go around to members of the committee plus hanger-ons.
So I would like to make a suggestion based on this agreement. Are you happy then to email those questions, please, to David, and then we could potentially add that as an item as well for future, for the work plan? Yes, are you happy with that? Great, thank you very much. Thank you. Yes, great. Thank you very much. Yeah.
I think a lot of the trouble is a matter of skill. We meet a lot of NHS people who individually are very good, and there's no irony in that. They are very good. They work very hard. But one thing it's impossible to miss, and that's the power of routine. And people do things over and over again, which partly work and partly don't work at all. And they still do them because that's what's done. And thinking sometimes, I saw an image a few days ago, which we all saw a few years ago. Remember the very large cargo boat, which is going to through this canal? It got stuck. Everything stopped. The captain didn't know what to do because he tried to do what he'd always done, but he was going sideways and he needed to go forward. He didn't have a clue. He was interviewed about it. The local NHS is partly like that. We're doing A and B and C and D, not because we have objectives, but because that's what we've done. And one thing I like about the council is it's agile. As far as I can work out as a resident, when you come up against a problem, you try to think how you're going to move things forward. And I think a dynamic local healthcare partnership might do that. At the last ICB, there was a presentation, and it might have been slightly oversold, but not a lot, from Brent Health Matters. They were actually going out rather than coming in. And I think if there are a whole range of communities which don't take up opportunities because perhaps because they don't know what they mean or they're available. The NHS needs to stop being in really good offices and to get out to neighbourhoods, teams, and work with people who do it, like the council does. And it does strike me, one can have a conversation, but it needs to be about particular questions, not a general thing. You're stuck and we're not. That's useless. But here's what we would like to do over the next year or 2 years, and how are you going to bend your assets to help move that forward? It's that kind of thing.
Thank you very much. Okay, so in terms of actions, because this links it nicely with the agenda item number 6, which is a work program. So are we agreeing that you're going to make some suggestions? Yes, going forward, and they will be emailed to David, and then they'll be circulated. Oops.
The agenda item will be how well is the health and care partner functioning or something like that.
Okay.
You can suggest the title, and then you're going to suggest the questions that you think that you would like the NHS and the council together to address. And it has to be a joint paper from the and the interesting thing will be the NHS will expect the paper has to come from them because that's what they always do. And it will be a challenge and a test of the health and care partnership if they understand it's a joint paper.
Great.
First hurdle.
Okay, so that's action agreed. Thank you very much. Okay, so agenda item number 7, dates of future meetings. Oh, sorry, Victoria. Please, Victoria, go ahead.
Sorry, I've got to leave soon, otherwise my PA will be late leaving and I'll get home late. But I just wanted to make a suggestion for our future work programme, if I may, before I go. I wonder if we could schedule a discussion, an item about disabled people's access to healthcare, because I've got examples of where disabled people have a difficulty accessing NHS services. I want to ask AOD to also ask members for their case studies as well. So maybe can we schedule that maybe for the July meeting or a meeting in the autumn, or whichever meeting you think is appropriate.
Thank you very much, Victoria, for that suggestion. So people's access to
disabled
health.
Yeah, disabled people's access to NHS care.
Sorry, disabled. Sorry. Oh, I'm sorry. Apologies. Disabled
people's
access to health care.
Yeah.
Do you think we that's one of those things where actually going out, gathering some data to inform the conversation would be helpful first, so we could instigate and maybe instigate a piece of work together. You'd wish as a committee to instigate a piece of work with Action on Disability, maybe to go and I can hear Victoria, you want to just come on, just finish. So we can actually gather opinions in first, and then we have a discussion based on some learning. Rather than just hearing out the committee.
Yeah, I'm going to ask AOD to gather data and examples as well. Yeah.
Sorry, Victoria. Oh, sorry, Victoria. Can you please repeat?
I'm going to ask Action on Disability to gather evidence from its members as well.
Okay, thank you so much for agreeing to approach Action on Disability to gather some evidence from the members. Thank you very much. Okay, colleagues, I appreciate your time this evening and all your contributions. Thank you very much, David, as well for your help facilitating this evening. And also, I know we're in the new venue, so thank you for putting everything together, and for the IT support as well. So the date of the next meeting is the 27th of March. So I look forward to seeing you all on the 27th. Okay, thank you. Have a